At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. Welcome to Dr. Tom Roselle Live. Beautiful Sunday morning. And just, to acknowledge the obvious and what's going on, we are a country in turmoil, and hopefully that we come to our senses and start working together and love each other and not set ourselves aside so more of what took place yesterday doesn't occur. Understand that we are a united people, not one that should be divisive and combative. Having said that, we wish our president speedy recovery and may God watch over him. We got a program for you today. We're going to be talking about low back pain, and that's going to be the topic of a program on Wednesday, August the 14th at 6 p.m. at the Roselle Center for Healing in Fairfax. How do you fix it without surgery? How do you fix it without a lifetime of drugs and medication and so forth? How do you get your life back? How do you get to a place where you can bend over again and tie your shoes properly? How do you get to a place where, every little move has to be guarded and watched simply because of the fact that if you move the wrong way, you're in trouble? Well, on the 14th at 6 p.m., Dr. Harlan Browning, as we lovingly call the professor, and I will be co-hosting a program for you and try to give you all the answers. And I promise you're going to go away with a ton of information. Those of you who have listened to Dr. Browning before know this man is just jam-packed with all kinds of information that you can use in a nanosecond. Having said that, let's get into the topic a little bit and let's talk about what really low back pain is all about. Did you know that something in the neighborhood of about 70% up to 80% of the world population suffers from low back pain at one point or the other, and that something in the neighborhood of about 40% plus of the people have low back pain all the time? And that's not okay. Some comes and goes, but they say, well, if I don't do this, I'm okay. But the symptoms of low back pain, because they modify, they go up and back until it's too late. And what I talk about too late, we'll talk about in a minute, those discs and the stenotic patterns and so forth. They say that it goes away within about 6 weeks or so. It doesn't go away. It's just more tolerable than it was before. So, we're outside in these days. It's warm outside, and you go out in the morning, you go out at night. 100 degrees is not too much fun, but nevertheless, if you want to go out and go for a long walk and you don't do it because why? Your back hurts and you may have some pelvic pain, some buttock pain radiating down your legs, that old sciatica or femoral neuropathy. That means it goes down the front of the leg instead of the back of the leg. And, you start limiting your activity because of that. And unfortunately, when we limit our activity, we limit our life. In most episodes of low back pain, there's unfortunately not an underlying specific cause relative to traditional, medical look at. The pain is believed due to be mechanical, such as a muscle or a joint problem. Well, I'm going to add to that as we go through. We're going to talk about the biochemical pieces that will trigger low back pain. That's right, biochemical. Your intestinal tract. Those of you who attended the in-house program the other night learned that your intestinal system can, in fact, cause spinal problems and spinal damage and degenerative conditions. There's other things. There's called viruses. They have a bad habit of trying to live inside joint spaces. So there's a triggering mechanism, and it's generally when immunologically your body's not working. But that's a topic we'll get into as we go through the next few weeks. But let's talk about what happens, when, this pain slowly, insidiously starts moving forward. Back in the day, we used to call it lumbago. That means that your back hurt. Big deal, right? So they say muscles and nerves and bones of the back and those kind of things. So the problem is that unless you identify the triggering mechanisms, you can't fix it. But in the natural world, in my world, in applied kinesiology, chiropractic, the things that we do there, we can identify it. I've had the privilege and the pleasure of treating a lot of very, very high-level athletes over the years, and guys like you and me, that were athletic in our own home, if you will. And so what happens is that I have to quickly look at what's causing the problem so they can optimize their day-to-day activity. That's called playing the sport that they're in. And if they have a bad back, there's no way that they're going to be able to do whatever they do. How many of you have a bad back and you can't even go in your garden, pick weeds? You have a bad back and you're going to have to use a cane to start moving you around. Well, one of the primary reasons for us, we'll set the athletes aside for a minute, that we have these problems is sometimes we have an overabundant middle section and there's no core strength to it. There's no support mechanism. So we have too much weight and we're out of shape, simply said that way. So as time goes on and we see more and more low back pain, in my world, I start looking at that. But let's look at the whole body. What else could cause low back pain? Did you know that if the skull, your big old head, your occiput isn't moving properly on top of your neck, your cervical spine, that there's muscles in your low back that will not fire? Isn't that interesting, right? They're called the iliopsoas muscles. They come from the lower part of your spine and they go down, they attach to the hips, and they will inhibit, we use the term weakened, they will inhibit and not support the pelvic low back connection the way they're supposed to. So you do something that you shouldn't be doing and you get hurt. In today's world, when we're on computers, we're on our phones, our heads are already locked down, and we're going to constantly cause those muscles, the iliopsoas muscles, not to fire properly. Now, you add that to a weakened abdominal area, now you've got a double whammy, and your back now becomes problematic. Now, there's many other causes of low back problems mechanically, and we're going to talk about those a little bit today, and then we're going to move on over the next few weeks to the infectious causes. And somebody say, oh my God, I must have a tumor. Well, it's very rare. Can it happen? Yes, absolutely can happen. But we need to be able to understand the differentiation. And, I use a statement that when you hear hoofbeats, meaning the symptom that's presenting itself, always look for the horses, not the zebras. When you hear something trampling outside, it's usually something that's very common. And if we can identify the commonality, we know what it is, we can tweak a few things, we can make it better, we're good to go, right? So again, we're talking about mechanical disruption. If you have a house and the house is built on a foundation that is solid, the rest of the house is usually in pretty good shape. But if you have a house where the foundation, the basement, is not working the way it's supposed to, then windows above that will begin to crack and the beams will begin to strain and they'll begin to alter their position. Same thing happens if your feet aren't working the way they're supposed to. Those of you, we used to kid around and say that as long as the shoemakers continue to make high heels for women, that we would contribute to the retirement fund. The reason for that is simply this, is that it forces the body forward and then you can't walk that way. So you extend backwards and now you're jamming the gliding points of the vertebrae, the bones of your back, and that causes significant amount of pain and other things as a result of that, because the nerves now get pinched and the nerve distribution to the organ systems and so forth. But what happens if your feet are flat? because you jumped on them too hard, or your feet are misaligned, or the muscles of your feet are inhibited for whatever reason, the rest of the body that is supposed to be supported by that platform is no longer going to be as strong, capable, and foundationally solid as we would expect it to be. So we have to look at all ends. We have to look at the skull. We have to look at the position of the pelvis. We have to look at the feet. And we have to look at the strength, the tensile strength of things. Now we're simply talking about the mechanical distribution. How about your posture pattern? How many of you sit at a desk and you have no support in your low back? How many of you drive cars where there's no support in your low back as you're driving? Or worse, you're slouched all the way down, your feet are all the way out. Same thing in a car, right? How many put that seat all the way back and you stretch your legs all the way out? There's no postural support at that level. So symptoms begin to come and go. Low back usually, shows up, oh, my back is sore, and you get into a hot shower, you take an NSAID, non-steroidal anti-inflammatory, what's that? Aspirin, Motrin, Advil, things like that, and it feels better for a moment. Or you're addicted to natural supplements. Even in my world, doing things naturally sometimes is not the best thing that you can do. So you take a whole handful of quercetin or turmeric, or you take a whole lot of magnesium or so forth, and hopefully that will help. Sometimes it does, and sometimes it doesn't touch it. But so you got to find out why that is. So we're talking about 20% of the population across all countries that have some sort of low back pain that is constant, ongoing, all the time. And the other piece is about 40% of the people have low back pain that just shows up. There's no reason for it. Why did it show up? Well, I'm telling you, it didn't just show up. You were doing something repetitively without supporting your back the way it needed to be supported. And what we're talking about this day is we're talking about the mechanical supports, the positional supports, the things that are not working in other areas of your spine. Remember something, there is nothing that works independently in your body opposed to something else. Your head works with your pelvis. Your feet work with the pelvis and the spine. The shoulder works with the hip. The wrist works with the ankle. That's normal mechanical presentations. If you put somebody on a treadmill and you watch them, there's a problem. Now, when we look at the lifestyle, which we're going to get into as we go through, we see portrayals of other things that may predispose, like what? Osteoporosis, loss of calcium from the bone itself. Do you know when we talk about osteopenia, osteoporosis, there's two different classifications. Osteopenia is when you can begin to see loss of bone mass on a flat x-ray. And to do that, you got to have over 25% that is beginning to deplete. Interesting, right? Where you would think, well, my gosh, it should show up before that. Not really, 25%. Now, once you get to osteoporosis, you've got like a honeycomb of your spine, and you can fall over and you can hurt yourself. So we have to look at the osteoporosis. We have to look at the spinal stenosis, if you will. That means the narrowing of the hole that the nerve comes out. And that usually is repetitive injury, compromise over a long period of time. How about those slip discs? The herniated discs, or the disc space that just begins to close down around a degenerative disc. So there's all kinds of things. We're going to talk about osteomyelitis. What's that? That's an infection of the bone, and it can happen from many different areas of the body and retrogrades to the spine. Now, when we talk about, let's go back to the anatomy a little bit, because I really want you to get this. I really want you to understand what the low back is all about. In the low back, we also call it technically the lumbar spine. There are 5 bones, 5 vertebrae, lumbar 1 all the way down to lumbar 5. Now, In between these vertebrae, let's talk about these disc spaces, these shock absorbers, the things that allow you to bend, twist, turn. The outside of the disc is like chicken cartilage. It's pretty hard. The inside of the disc is like toothpaste. So that's what gives it the pliability. So when you hear about a slipped disc, it's this toothpaste-like substance that's pushing its way through this outer hard shell, this cartilage, this chicken cartilage, if you will, because it's cracked and fissured because it's not getting what it needs. What's one of the things, I'll kind of lead into some other things we're going to do, it's called water, my friends. Your discs are 75% composed of water. So if that's the case, and all you're drinking is coffee or tea all day long and sodas, you got a problem simply because you're going to be dehydrated, if nothing else. And there's other reasons as well. Then we have these gliding points in the back part of the disc. I mentioned a little while ago, they're called facets, gliding points. That's all you have to remember. If you hear facets, think about gliding points. They allow you to bend and twist and turn and rotate and so forth. Now, those two bones, a disc, and the nerves that come out in between the two bones, it's called a motor unit. So if you hear these terms, it's not a big deal. It's two bones, a disc space, a shock absorber, if you will. The spinal cord comes down through the back of it. It gives off these nerves. You got 31 pairs. Low back, we have five vertebrae, 5 bones. They come off, and then they go to where they're going to go. It's when they're compromised. Now, let me tell you something about the low back as well. That disc that's in between the two bones used to be thought many years ago that it didn't have any sensory fibers. What do we know about it? Now we know that it probably has more sensory perception than virtually any place else in that motor unit. Crazy, right? We're learning more and more about these things. So that means when there's no motion, when there's dehydration, when there's cracking, when there's fissuring of this disc material, this shell that surrounds that toothpaste, if you will, inside, you can have pain. And when typical radiologists, and they do a great job, they find things, but the functional pieces is what they set aside. They don't understand that when there's a off-centering, a little bit of off-centering of these vertebrae in the chiropractic profession, it's called a spinal subluxation. It means small dislocation. We're talking about millimetric movement. In the osteopathic profession, it's called a spinal lesion. It simply means the same thing. They're not doing the mechanics the way they're supposed to be doing. So the problem is that not only do we have these bony hard substances, but now we have muscles that surround them. We have little muscles that go from the center of the vertebrae one to the other. They're called the interspinous ligament because those bones you feel when you rub your hand up and down somebody's back. That's the spinous process. So we call the interspinal ligaments. And then they have wings, and there's called transverse processes, and there's muscles that go between those. Those are called the intertransversarii. Big deal. In between the two transverse processes. That's all it means. But if these guys aren't holding together the way they're supposed to, then there's no flexibility, or there's too much flexibility. And then the long muscles of your back, it starts in the low back, way, way, way down in your pelvis, called the sacrum. And then it goes up through these spinal areas. So they're called the sacrospinalis, sacrospinal muscles. So that's how they get their names. I mean, it's not a big deal. You can figure it out. It's pretty easy. But here's what we have to understand. Pain that is caused by this unpleasant, noxious feeling, if you will, can be finger pointing if you break it down the way it's supposed to be broken down to understand the process. So it's a detection process. And the reason you feel the pain is it's interpreted by the brain, right? So, but there's these long up and down cords from the spinal cord. We'll get into that some other time. I'm not going to get into that today. And we'll try to break it down for you. But I promise you, when you come in to see us at the Roselle Center, we're going to really educate you. We're going to tell you all about this. And don't forget, That's coming up on the 14th of August, 6 p.m. at the Roselle Center for Healing in Fairfax. I promise you, you're going to learn a lot that night. You're going to walk away with some exercises that you can do, some environmental changes that you can make happen. So make sure you're there. And by the way, remember how you register for these classes? You go online, you go to rosellcare.com or drtomroselle.com and register. There'll be a sign there. Click it, register, and remember, if something comes up, can't make it, please let us know so we can save that seat for somebody else. So we'll have a great night for you. Please join us for that evening. Dr. Browning, again, the professor, will be my co-host, and we're going to try to give you as much data as we possibly can. We're going to talk about what really happens. We're going to talk about the relationship of when it hits the brain, why you have pain. We're going to talk about how the body intertwines itself on an ongoing basis. Now, the other thing that I want to encourage you to do, please make sure that you share our podcasts and you share the live stream, which I'm going to go into immediately after this. Don't forget to join me. It's Ageless Health live stream with me, and we're going to do some show and tell. You get to see the mug, the face on the live stream, and we're going to kind of show you the mechanics. We're going to continue talking a little bit about low back pain, but I'm going to get into a little different approach on this and give you a whole lot more information. So if you want to go out and play that golf game, you want to do the things that you need to do, then there's a way of getting it done. We have to make sure that you're there. So drtomroselle.com, Ageless Health live stream, and we're on all your social media sites. So make sure you follow me. Please follow me and tell your friends to follow me. And we'll make sure that we get all the data, all the information that you need to really handle so many different things in your life. You know, once you hear things say like thalamus and limbic and neurotransmitters, you don't know what they really are. I'm going to break it down so you get it, so you really understand what they are, because it's really simple when you bring it down into bite-sized pieces. You know, I tell my doctors, explain things to people like you're explaining things to a 12, 13-year-old, or like me, I'm brain dead. I need to have, broken down in really easy pieces. So join me real quickly now. I'm going to wrap up, and we're going to continue the process on Ageless Health live stream. Go to drtomroselle.com. You can click it there or follow us on social media. Remember, I do this every week and continually all the time for only one reason only. One, you deserve the information, but more importantly, I love you all. Have a great Sunday.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Low Back Pain on Wednesday, August 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.